here today at Tech Ridge Oaks Assisted Living and Memory Care in North Austin, Texas. It is a gorgeous community, just over 4 years old. I'm here with Dr. Nhue Ho, and he is with Total Care to You. And that is a practice. Tell us a little bit about it, Dr. Ho. About yourself.
We are actually in multiple communities. We're in Dallas, San Antonio, Austin, Houston, and surrounding area. We actually go to patients' home and take care of them and be their primary doctor at home. We try to prevent them from going back to the ER, going back to the hospital, and we provide 24/7-hour call for them. And they're always able to reach us because there's always a doctor and nurse on call 24 hours a day, 7 days a week, to make sure our patients are well cared for.
Perfect. Thank you. Well, that's terrific. Thank you for joining us today and taking time out of your busy schedule to do so.
Thank you.
So, February is American Heart Month. And we observe it, each year more than 600,000 Americans die from heart disease, and it's 1 in 4 deaths essentially each year. But we thought it would be really important for us to kind of bring this news to you and kind of share with you all some of the warning signs, the different symptoms that might take place, lifestyle changes that impact your risk level for heart disease, things we can do to mitigate those, and the different types and symptoms, right, for each one of those heart diseases. There are several, actually, that are out there.
Right. Some of the symptoms for you you have heart disease or chest pain, especially when you do activity and you have chest pain, shortness of breath, loss of appetite, no energy. Those are all symptoms, are early warning sign of heart problem, that you could be having a heart problem.
They say that 1 in 5 heart attacks are silent. You don't even...
Yes.
What does that mean exactly?
So it means that you could be having a heart attack, but you don't feel it. I have seen where I'm standing in front of a patient where the patient I know have a heart attack because I can see their EKG, but yet they don't feel anything. And those are silent heart attacks. So 1 in 5 are silent heart attack.
Okay. So there are many different types of heart disease.
Yes.
Each one of them is going to have its own symptoms and treatment.
Right. So when you think of heart disease, people think of coronary artery disease, which is the blood vessel supplying blood to the heart is blocked. That's one heart disease. Another problem is congestive heart failure, where your heart doesn't pump as well. That's another heart failure. And then you have an infection of the heart, like endocarditis, which is an infection of the valves. You can have pericarditis, which is inflammation of the pericardial sac, which surround the heart. So those are all different type of heart diseases. But whenever we talk about heart disease, everybody think of coronary artery disease, which is blockage in your arteries that supply blood to your heart.
Okay. Arrhythmias, heart arrhythmias. Tell me a little bit about that.
Arrhythmia is basically the electricity of your heart, right? So basically when the atrium, the top chamber squeeze, it let the bottom chamber know, and the bottom chamber also squeeze. What happened is that signal get messed up in somehow. So you have arrhythmia, and there's multiple type of arrhythmia that basically we can go into more detail, but the rhythm basically your heart start beating irregularly.
What's interesting is that I personally have seen this. My mother recently was in the hospital as a result of her heart was just beating so quickly.
Okay.
And so they went in and she was in there for a couple of days in ICU because they went in and they did it was a type of medical. They essentially recharged her heart. What is that called again? I should know this.
Right. So I'm thinking what she had was atrial fibrillation.
Yes,
that's
correct.
What she had. And there's multiple ways to treat. One, you can treat with medication, but sometimes medication doesn't help, so they go and do ablation, which is they go in there and they cut the wire that basically make the heart beating faster. So they cut that wire, and maybe that's what they did. I'm not sure, but that's called ablation, right?
Yeah, the recovery. She thought she's had this before, and so the first time they were managing it with medication,
right?
And then we went down several years later. Now we have another episode, and so this one required a different type of intervention,
right? So when you have atrial fibrillation, the worst risk is actually a stroke, because when the heart the blood doesn't move, the blood tends to clot. Okay. And that's what the atrium is. In arrhythmia, in atrial fibrillation, the top 2 chamber, which is the atrium, it doesn't squeeze, it kind of fibrillate, and so the blood pulls in there, and when the blood pull, you can have blood clot. When the blood clot goes to the ventral, and the ventral pump it out, it can go to your brain and cause stroke.
And that was what they kept saying. That was the thing that they were most concerned about.
Yes.
Yeah. So it was very a little bit intense there for a second there. But
Yes.
yeah, I'm glad we're actually able to talk about that a little bit more and share my own personal experience with heart disease. So
Yes.
tell me about heart failure.
Heart failure is basically, when we talk about heart failure, we're talking about the blood is not going out to the body well. So that could be the squeeze in the heart where it doesn't pump, it's not as strong. So, when you squeeze it, not enough blood go out. So let's say this, we use the term ejection fraction, which is the percentage of blood going out when heart squeezed. So a normal ejection fraction is 67%. So about 67% of the blood in the heart will go out, while remaining in the heart is about 30% left. Okay, but in heart failure, in congestive heart failure, less than 6% going out. So you can have 30%, 20% going out, and the rest remain in the heart. That's because the heart doesn't squeeze as well. Now that is systolic heart failure. You have diastolic heart failure, which is a little bit different, which is the squeezing is fine, but it's not relaxing enough where the blood can flow into the heart. So there's a different type of heart failure, and the treatment is a little bit different for both.
Okay. What about heart valve disease?
Heart valve disease, there's more, you have 4 valves of your heart that basically regulate the blood flowing from the lung, from the body to the heart and going out. And basically when you have infection or when you have heart valve problem, then it's kind of like a gate. It's not opening very well, and that doesn't allow blood to flow very smoothly. And heart valve could become more, there could be genetics, it could be infection, something even like rheumatic heart disease cause a lot of heart valve problem. That's happening. So the heart valve is basically just a valve not functioning well, so the blood doesn't flow as well.
What about cardiomyopathy?
Cardiomyopathy is basically the problem with the muscle itself in the heart. Okay. So cardiomyopathy, basically, the heart's not. When we think of cardiomyopathy, the heart's not squeezed very well, and that's not due to the blood supply. It's actually due to the muscle itself being damaged. So what can cause this? One is genetic. That can actually cause this. You can have septal defect that can cause this, which means there is the wall between the right and the left ventricle there's a problem with it. So that can cause cardiomyopathy. Alcohol can actually, of course, can cause also cardiomyopathy. So infection can cause cardiomyopathy. So cardiomyopathy is actually the problem of the heart pumping, but it's not due to blood supply of the heart that causing this problem.
I understand. Is there a way to strengthen that heart muscle?
Yes, so there's medication. Whenever you have, depending on what type of problem it is, yes, there are medications that can actually help the heart to pump better, yes.
Okay. What about congenital heart disease?
Oh, congenital heart disease, well, that's what I mean. You were born with it. And there's a multiple thing. You can have congenital heart disease of the valve. You can have heart, you have the septal defect is congenital heart disease. But those are genetic, and those are actually, you're born with it.
Yeah, so you would know well in advance of older age,
yes,
right?
You would.
Have
Most of them, yes.
Okay. What would you say are the major risk factors for developing heart disease?
Oh, there's a lot of risk factors. Family risk factors, so your family has a heart problem, you're at high risk. Diabetes, if you have diabetes, no matter how well your diabetes are controlled, you're at a high risk problem. High blood pressure, high cholesterol, smoking, alcohol, no exercise, those are all risk factor for heart problems.
Okay, thank you. And stress, right? Stress is another one.
Yes, stress is a major player for all of us. We're all under a lot of stress. But yes, stress can cause a lot of problem with not just heart, but with your general wellness.
And diet is also going to play a part, right, for heart disease?
Well, diet actually, because you have to watch for your cholesterol intake, right? And so the diet can actually harm your heart. Yes.
Okay. So you think you might have heart disease. You're at risk because of hereditary factors. How do you go about testing? How do you find out?
So there are some genetic testing that would tell you are predisposed to having heart disease.
Okay.
So there's multiple tests out there. But the most important thing is actually annual visit to your doctor. Your doctor, you go, you have an exam, make sure your blood pressure's okay, make sure your cholesterol's okay, make sure diabetes is under control, all that problem, and also exercise, right? But major thing is you have to go to your doctor on a regular basis for this.
And during those annual physicals or physical examinations, they're going to change, right? As you age, they're going to introduce new testing to spot these, to detect early signs of heart disease. Is that correct?
So like for example, I never think of a 20-year-old person who have heart problem unless he used like cocaine, right? I mean, cocaine actually known to cause coronary artery disease. So, but yes, as you go through this, there are different testing. The doctor usually do a stress test on you as you get older. If you have any symptom, he'll do a stress test on you to see if you have a heart problem or not.
Is it the EKG where they put the little...
Right. So EKG is basically just look to show the electricity of your heart and how well your heart electricity. But that's not the only thing that will tell you have heart problem or not.
Okay.
Yeah.
And just to wrap it up, so let's say that you are predisposed or you're concerned about developing heart disease. Let's kind of go through some of those items one last time for our audience. Things that they can do, lifestyle changes that they can make to reduce the impact of heart disease or the likelihood of heart disease.
One of the things that you need to do is stop smoking. Smoking is a problem, okay? It is drugs. Don't take them, okay? Exercise. Make sure your blood pressure and your cholesterol is well controlled. Make sure your diabetes is well controlled. And when I say exercise, I'm talking about aerobic exercise, not anaerobic exercise. So aerobic exercise is needed for your heart to stay healthy. Okay? So those are major things. Your diet, but the diet goes with the cholesterol. So those are things you need to look out for and improve on.
So let's go. You have a heart issue, right? You have a heart attack. You go into the hospital. You're treated. They stabilize you. You go to a rehab hospital, perhaps. Going to do some intense therapy there, and then they're going to go. They would discharge home or to an assisted living environment. Tell me about how can once they're at that point, they're post their rehab stay back in their homes. What are some things that they can start paying attention to and doing, just to kind of to get a better handle on managing it on their own, their heart disease?
So once you are diagnosed heart disease, you need to go see your heart doctor or your primary care doctor on a regular basis. You have to, because
are we talking every month? Every 6 months?
Well, usually when you first had a heart attack, then it's usually every month for like 1 or 2 months, and then it go out further, and depend on what kind of heart problem you have also. Then the doctor may advise you to get a stress test on a yearly basis, or even every 2-3 years, depending on your cardiologist. But that is, you need to follow the doctor, number one. Number two is you need to change any lifestyle that could be harming your heart. Smoking, drugs, high blood pressure, diabetes, cholesterol problem. Those are all risk factors you can help to reduce you from getting more heart problem.
And I'm sure that you see individuals in your practice every day that have heart disease.
Yes, I see that every day. Heart disease is very common in the U.S. So yes, we see that every day. And it doesn't mean you can't have a good life. It does not mean that at all. It just means that if you watch, what you do and really take care of yourself, you can live a long and prosperous life.
Wonderful. Well, I thank you again so much for giving us a highlight and overview of heart disease and things we can do to reduce our risk factors, some of the signs and symptoms to look out for. I appreciate it. Thank you again for taking time out of your busy schedule.
Well, thank you so much for having me.
Yeah, absolutely. Well, we'll see you again next time. If please feel free to comment your experience, personal, family, others that you may know that have heart disease, how they handled that, lifestyle changes that maybe they made. And we will see you again in the near future. Thanks again for joining us. Have a great day. Bye now.
Bye-bye.